In your home injection kit, you're going to have a couple of different supplies. You'll have your syringe, your needle, your drawing port, and your alcohol swabs. You'll also receive in your mail the medication, and that'll come directly from your pharmacy. To start with, you'll want to take your drawing port, and there's this little plastic piece. It'll pop off. And then this is now sharp, so you want to be careful with it. And then you're going to take your medication. It'll have a lid on it. You'll flip it off. And then this goes right in the middle of that circle, and you just push it down inside of the vial. This will allow you to continue to reuse it. Sometimes it doesn't go all the way in, so you just want to put extra pressure and twist, and then it'll seal itself on there. Before each use, you'll want to take your alcohol swabs and cleanse the port, so that way you remove any bacteria that could have collected while you're storing it in the refrigerator. Next, you'll want to take your syringe, and it goes right onto the top here, and it pushes on and twist, and it should lock on there. Sometimes it doesn't, just push again and twist. To draw your medication, you're going to want to flip your vial all the way upright, so that way the medication is down into the needle. And then you'll pull your syringe back. Sometimes you'll get an air bubble. You just want to kind of flick it and then push it back up in there until you don't have an air bubble any longer. And you can take a couple little pulls back and forth. Next, you're going to want to draw down to your initial starting dose, which is going to be at 2.5. So you're going to be right in between the 2 and the 3. There's a little marker right there, and then you put the stopper right on that marker. Once you have your dose that's been ordered, you will twist this off of here, and then your medication is ready to inject. So you'll want to take your needle. This little piece here twists off. That's the cap over it. And then this now twists into your syringe. Next, you will want to cleanse the area where you're going to inject with your alcohol swab, and then you will remove the needle cap. So this is now sharp, so be careful. You will pinch the area of skin where you're going to inject, push the needle in, and then push the stopper to inject your medication. And you go all the way down until you hit resistance. Pull out, and then you'll recap your needle, so that way you don't hurt yourself. You'll then put this inside a sharps container, which can be a milk jug or an old juice carton, just so that way you keep you, your pets, and your kids safe. When you are finished with the medication, the whole vial is empty. You'll take your drawing port out, and then that also will go into your sharps container because that is now pointy. And so you'll get a new one for each new vial that you use.